Okay. So I'm going to memorize the infective and diagnostic form of all the parasites using logic and knowledge. Okay. So first of all, Diphyllobotrium latum. Okay. So first of all, most of the diagnostic forms are egg. Okay. And then this is random, but mostly trophozoite and egg. Okay. So first of all, cystodes. In cystodes, Diphyllobotrium latum. Infective form is pleurosarcoid larva. We'll have to remember this: Diphyllobotrium latum, pleurosarcoid larva, and it's the tapeworm, right? It has segments, so segment of tapeworm and egg. Then Tinea saginata and Solium. This is easy. This is a PYQ, and so Cystosarcus, Tinea saginata, so bovis, and Solium is cellulose. Then diagnostic form is again egg, and for Cystosarcus cellulose, diagnostic form is also larva, egg and larva, Cystosarcus cellulose larva. Okay, and then Echinococcus granulosus and H. nana, for both infective form is egg, and Echinococcus granulosus is hydrated layer, right? And then H. nana is that organism that is very small and that has nothing. Okay, that has only one host. Okay, so diagnostic form is Echinococcus granulosus, hydrated cyst. So its diagnostic form we all know, it's brood capsule and protoscoliosis. And H. nana, since it's very small and it has nothing, eggs are all it has. So infective form is egg and diagnostic form is also egg. Then trematode, it's very easy. Cystosoma is the rebel, right? So it doesn't have cercaria, it doesn't have operculated egg. So all other trematode have infective form metacercaria, but Cystosoma have infective form cercaria. All other have infective form operculated egg and non-infective infective form operculated egg, but Cystosoma infective form non-operculated egg. And then nematode. This is a bit random, so we'll have to memorize. First, we'll do the infective forms. Okay, so Ascaris lumbricoides, egg, and Enterobus vermicularis, egg. It's better to do together. Okay, Ascaris lumbricoides, infective form is egg, and diagnostic form is also egg, but they are going a bit specific and telling that it's an unembryonated egg. Okay, and then Enterobus vermicularis, infective form is egg, and again diagnostic form we all know from perianal skin. They will. Okay, and Ankylostoma duodenale and Nicator americana. Okay, so this is filariform larva. We'll have to just remember this filariform larva. And stool, fresh. If it's fresh stool, it's egg, because just past the stool it's still in egg form, and then if old stool, then it is larva. Filaria and Recunculus, L3 of filariform larva. And infective form for filaria, it's microfilaria, like we do DSC provocation test and stuff. And for Dracunculus, it's adult worm, right? The worm that's clinging to the Hippocratic oath symbol. The worm that has its Dracunculus, right? So it's the diagnostic form is adult worm. Trichinella, first stage of filariform larva. Infective stage is the first stage of filariform larva, and the diagnostic is Trichinella antibody test. It invade the muscle, right? So it causes like some immune reaction. So antibody test. Okay, then this is easy. Entamoeba histolytica and Giardia lamblia both cause diarrhea, and both have infective form quadrinucleate cyst, and diagnostic form is both trophozoite and cyst. Okay, then Trichomonas vaginalis and Naegleria fowleri, both don't have cyst. Okay, Trichomonas anti don't have cyst. Naegleria fowleri and Acanthamoeba have the difference that Naegleria only have trophozoite. So infective form is also trophozoite, diagnostic form is also trophozoite. Then Acanthamoeba. Okay, so in Acanthamoeba, trophozoite and cyst both. We read that Naegleria and Acanthamoeba has it all. Naegleria has less, so Naegleria is more severe, more aggressive, and so Acanthamoeba has infective form both trophozoite and cyst, and diagnostic form tropho. Balantidium coli, both cyst, only cyst. Infective form is also cyst, diagnostic form is also cyst. Okay, then Leishmania donovani. Pro is pro, so it infects promastigot. And Leishmania donovan body is amastigote inside macrophage, so in diagnostic form is amastigote in macrophage. Then Trypanosoma cruzi and brucei. Metacyclic, it's met, right? Trypanosoma, I have this mnemonic metacyclic trypomastigote and epimastigote, something like that, I don't remember. Infective stage is metacyclic trypomastigote and diagnostic form is trypomastigote. Then Plasmodium, infective form is sporozoite in saliva of mosquito, and then diagnostic form are various, seasoned, then trophozoite, then gametocyte. Okay, then toxo has all three. Okay, so this is important. Bradyzoite in meat, oocyst from cat feces, and tachyzoid, I think, infective stage, and then diagnostic form are tachy and tissue cyst. Then this is important, Cryptosporidium, parvum, cyclospora and isospora. Okay, so sporulated oocyst is Cryptosporidium parvum, sporulated oocyst Cryptosporidium parvum, cyclospora cyclospora is okay, so this is important. Infective stage is sporulated oocyst for all three, and Cryptosporidium parvum, in stool they pass sporulated oocyst, so it can cause auto-infection and quick infection. So diagnostic form is also sporulated oocyst. For the other two, diagnostic form is unsporulated oocyst. Okay, thank you.